Okay, third attempt. We're gonna go for it this time. No more talking to myself. The bones of the appendicular skeleton. We've covered the bones of the axial skeleton. We looked at the skull, made up of the cranium and facial bones. We looked at the vertebrae and the different curvatures. We looked at the thoracic cage. And now we're moving on to show the connection with that the axial skeleton has with the appendicular skeleton. And we're going to start on top and work our way down. So we've got the pectoral girdles, also commonly called the shoulder girdles. This girdle connects your axial skeleton to the upper limbs. It's made of two bones, your clavicle and scapula. You can see in the notes, also called by common names, the collarbone and your shoulder blades. These bones are important in the pectoral girdle to support your arms and attach muscles that move them. So, as we keep going down, let's take a look at the clavicles. Slender and rod-like, they go horizontally from the sternum and the scapula out towards your humerus. Now, we're going to learn about different features of the bone. And commonly, joints are going to be named after those features from the two bones that they're articulating, that are connecting there. So, I'm going to show you on a picture where this acromyoclavicular joint is located. All right. I'll just shuffle it over a little bit and like this. And we're going to look at the anterior view because that's where your clavicle is on the front. So here is the joint they're talking about. Your clavicle articulates with your scapula in two different spots. This one is the acromyoclavicular joint, and then this process is called the coracoid process. So even as you look now down at the notes as they continue under the scapula, you can see the two processes are the acromion and the coracoid process, and they are both on the anterior side. Now, if I slide this over, and you've got a posterior view, this would be the acromion process, and this is going to be that coracoid process. Again, they're in contact with your clavicle to help make this joint where your humerus is going to fall. All right. Function of the clavicle, hold your shoulder in place. Yep, if you've ever broken that clavicle, you know you know what it's like for treatment, and in addition to the painfulness. All right, moving on to the scapula, the other bone that makes up your pectoral girdle. You can see it off to the right of the screen. They are located lateral to each clavicle on either side of the upper back. So again, lateral means away from the middle. You can see that triangular shape, and then the two prominent processes, as I mentioned before. The acromion process and the coracoid process. Excuse me, cancel that. It's right there. So that's where we're talking when we're talking about these two processes. And again, if you take a look at the description, lateral end of the spine, coracoid process arises anterior to the acromion and curves laterally. So you can see, and we'll have pictures. You should have your textbook open to the different pictures. We know that these start on page 158, talking about the bones of the appendicular skeleton. If you have that open during your note-taking, it'll help make that connection between these crazy words that make up a whole different language and what you're looking at with the human skeleton. Now, in between these two processes is an oval depression called the glenoid cavity. This is where the head of the humerus is located. And if I slide this in just a little bit, you'd see right there. Okay, so acromion process, coracoid process, and then this depression is called the glenoid cavity, and it makes up the glenohumeral joint. So all these different surfaces, edges, processes are important sites for muscles, muscle attachment, that are going to move your shoulder and upper arm. Other features that we're going to talk about, and you'll see when you look at the scapula, would be a subscapular fossa. And then again, think about those, breaking that word down. What is a fossa? It's going to be a slightly indented depression. And then when you start looking at, here's the spine they talk about. Look at that spine right there. That divides your scapula into two portions, supraspinous and infraspinous fossa. So again, they're slight depressions above and below the spine. All right, so that's your pectoral girdle. The clavicle and scapula make up the pectoral girdle, which basically become that anchor for your humerus, for the upper arm. All right, so let's move on to the upper limbs. Within your upper limb, you have 60 bones. So from the humerus down to your phalanges, if you were to count them all up, you would have 60 bones that support your arms, wrist, hands, and fingers on each side. Now, we know that the humerus is the long bone of the arm. It's going to extend from your shoulder to the elbow. And we talked, when we talked about the ribs, we talked about the head of the rib. You know, that head is that larger end of the bone, and this head of the humerus is going to be found in that glenoid cavity that we talked about. And that joint then is where the humerus comes into the glenoid cavity. So again, that's the name given to that joint. The two bones where they articulate is the name for that joint. I'm not going to try on this picture to point out the next terms. This is where, again, your textbook would be an excellent source to have open as you take the notes, so that you can see, as you move distal to the head or away from the head, the anatomical neck. Okay, this groove is going to separate two projections, and again, as you can see, one's going to be larger than the other. One's called the greater tubercle, the other one's the lesser. But notice where they're located on the humerus. You have to remember again, where's the lateral side in relation to the body and the anterior side. These features provide the attachments for muscles that move, again, the arm at the shoulder. As you continue to go down the humerus, you're going to find a groove. And if you look at intertubercular, it's going to be found between the tubercles. Another neck, the surgical neck. And then as you're going down now the bone shaft, you have what's called a deltoid tuberosity. And this is where your deltoid muscle, which comes up over your shoulder and then comes down and attaches to this feature on the humerus, deltoid tuberosity. All right, I'm going to switch over a little bit because this first picture we talked about didn't go as far as this one. And again, it's just the basics. As we get down to the distal end now of the humerus, we're running into your elbow, the elbow joint. So as you look again at the end of the humerus, and this is a pretty rough drawing, so again, grab your textbook. There's two smooth rounded processes, the capitulum, which is on the lateral side, and the trochlea, which is on the medial side. If you remember where the radius and ulna are, you're going to remember which one of those processes they're going to continue to articulate with. So you can see the radius is going to articulate with the capitulum on the lateral side, ulna on the trochlea, or with the trochlea on the medial side. Okay, again, processes are those projections, and you have two more now that form lateral and medial. Again, keep thinking, where are those at on your body? Where are they in relation to the middle of your body? And these are called epicondyles, attachments for muscles and ligaments. Then we've got some fosses, which mean they're the depressions. So again, if you just take a look at the very distal end of your humerus, you want to be able to identify the names of the processes and also the fosses, because that's where you're going to find the articulation with your radius and ulna in the lower arm. All right, last two things here. We're a little over 10 minutes, so I'll just slide it on up and talk about the last two bones of your arm, and then get down to your wrist and hand. The radius is the lateral bone of your forearm. It's always in line with your thumb. So try and keep that in mind, whether you are standing in anatomical position with palms forward, or you've actually supinated your hand so that the palm is down. Your radius is going to always stay in line with your thumb. The disc-shaped head is on the proximal end. Radial tuberosity is going to attach your biceps. And then the styloid process, way down at the distal end, is going to attach ligaments to help move your wrist. So that's your radius. Next to that, medial to the radius, is the ulna. And notice now, we've got the olecranon process and the coronoid process. And a process, again, is a projection. If I scroll back up just enough, look at that. Olecranon process, olecranon fossa. Coronoid process, coronoid fossa. So that part, you can see, of the humerus is going to articulate with this end of your ulna. And from the picture, you can even see that. The ulna is articulating with the humerus. The radius there is medial to your ulna. Radius is lateral, excuse me. Whew. Radius is lateral to your ulna. Let's say it's next to it. All right. And then we have a trochlear notch. There's another connection up here. Remember, we had the trochlea, which was a process found at the end of the humerus, the distal end. Now a notch is just that. It's a cutout piece of the ulna, and that's where the trochlea of the humerus sits. Now this is a little different than we had with the radius. The head of your ulna is found at the distal end, down by the wrist bones, down by the carpals. And just like your radius had a styloid process, so does the ulna. All right, again, a lot of terms. I want to encourage you guys to make some flashcards, just keeping all these different structural features straight. It's going to take some work. And we will be in the lab. Let me keep talking and slide this up. We will be in the lab looking at the bones of the skeleton. I've got a box of bones that are not attached into a full human skeleton, and we're gonna identify all these different structural features, from tuberosities to fosses to condyles, notches, and your goal is going to be to try and put the bones together and actually have them articulate correctly with, you know, we could even say making your own skeleton in that sense. Kind of like you did with the vertebrae in class. So we've done the humerus, gone down into the radius and ulna in the forearm, and now we hit the carpals of your wrist. There are 8 bones in your wrist, 8 carpal bones, 5 metacarpal bones, and 14 phalanges. So I'm going to just leave this up. You can see the different names. You can see how they form. Your knuckles. If you make a fist, the heads of the metacarpals are your knuckles. We can talk about proximal and distal phalanges. Think about your thumb. Your thumb only has 2 phalanges compared to the 3 you find in your fingers. But I'm almost out of time. I'm done here at 15 minutes, so I'm going to go ahead and sign off. If you need to, watch this lecture again.